Welcome back to another great episode of Better Nurse Court. It's your favorite color in the world, brown, along with my co-host Ruse, and we are here for another one. So we got something very, very important to talk about, and I think this is a very important topic to discuss, especially amongst new nurses. If you're a new nurse or a new nurse practitioner, I think this episode is a good one to listen to, strictly because this could happen to anyone, and it does happen to a lot of people. And that topic is nurse to nurse bullying. It happened to me, happened to you, Ruse, and I'm sure it happened to you.
Yep. Unfortunately.
It happens, and I remember before I became a nurse, and as you all know, my sister is also a nurse, and one of the very first things that she mentioned to me was, be careful because nurses eat their young. And I really didn't understand what that meant until I became a nurse, and after 6 months in, and I felt bullied. I felt like these nurses, this one nurse in particular was coming at me. Nothing that I did was right. I couldn't find any good things that I did overnight when I was, working my night shift nurse as a new nurse, and it was just handing him off, report in the morning. It was horrible. So, I experienced it, after a while, and I always said if I was to ever precept somebody, I would never ever treat a new nurse like that. But, having said that, talk to me, man. Have you experienced any type of nurse to nurse bullying?
Who hasn't, right? Who hasn't? Before we get into my story, though,
Okay, all right.
I want to dive into yours a little
All
bit.
right. Let's do it.
You kind of pointed out a couple of things that I think is remarkable for everybody to keep in mind. How that made you feel.
Mm-hmm.
How did that impact your work and your ability to learn as a new nurse?
All right, so
as a new healthcare worker, you don't even have to say new nurse, right?
Mm-hmm.
Because once you enter this world of hospital, right, it's a new world.
Right.
It's a new world. It's a new playground. It's a new school. It's a whole new set of things, and that never goes away, in my opinion. That idea of like we grow up and we interact differently with each other as grown-ups. I think we're a bunch of little children still in a high school, and the bullying and the fraternity, the sorority, the non-gender, what they start clumping together.
Yeah.
These cliques form,
Mm-hmm.
right? Cliques form, and it allows for bullying to happen. And it sounds like you've experienced that. I sure as hell have.
Yeah.
And we'll talk about that. But how did you, as a new nurse?
Yeah, I mean,
were you able to learn?
It was tough. Was I able to learn? Yes, because I felt like I wasn't going to let that person get the best of me. And, having been bullied as a younger child, I felt like I was prepared for that moment. Like I was prepared for that, for this. So I wouldn't allow the bully to defeat me, I guess. In my head, I was like, all right, well, I got something for you next time. And ultimately, it made me a better nurse. And I will say that. But I felt like, in hindsight, I felt like I didn't have to get to that point. I felt like it could have been done a more healthier way, because if I didn't have that mindset, if I didn't have that in my head preparation of a bully and how to deal with the bully, I probably would have had mental health issues. I probably would have been influenced. It would have made me, not give proper patient care because I wasn't acting as my best nurse, as my best self. So during that time, it was rough, I'm not gonna lie. But I think I had that preparation. But I do know people that haven't had that preparation.
Right.
And it does.
Not all of us get bullied when we grow up, right? Unfortunately, it might not. It actually might scar you to the point where you might find yourself in that situation, and it might be a triggering thing for you, right? People handle it differently. My situation, very similar. It even happens in the most recent, employments, regardless of the degree. Luckily enough, when I was a new nurse, I was taken in by my Filipino family and my night crew family, and I was given a very borderline bully, and you kind of hinted it before. You said you became a better person because of it.
Mm-hmm.
My person was very militant.
Okay.
And we'll talk about that.
Yes, we will.
In my most recent employment, though, there is this one person that comes off very aggressive. They come off, so as a new practitioner, you make mistakes. You don't know the workflow exactly. You don't know all the processes. And no matter how much knowledge you have up in here in theory, in practice, so many different things can go wrong, not making excuses, but you make mistakes. How the person who is more experienced than you deals with that can make or break you. Perception is one way, right? If I perceive it as bullying because they're overtly aggressive, why did you do that?
Right.
Or why didn't you do that?
Right.
Right? As opposed to, you shouldn't have done that. This is what you should have done instead. Or why did you think you should do that? Even the why questions, people say we shouldn't be doing why questions. I like why questions. If you phrase it properly, a why question is harmless. Like, why did you think you should do that? Like, maybe we should be thinking about it this way instead, right? Two different mentalities, right? Same message. You made a mistake. This was the corrective action to do so. Okay? Don't let it happen again. Right? Militant was my original preceptor. She would let me know when I made a mistake. You made a mistake. There was no emotions behind it. There was no, right? So that could have been perceived as cold, right? But it never was. It was militant. And I definitely found myself in that sweet spot whenever I found myself in that sweet spot between if it's militant versus borderline cold bullying.
Right.
That's what I've learned the best.
So,
which is kind of weird. I don't know if that's normal.
So no, there is a distinction. And for those of us that have children, you understand that if you have multiple children, you know that each child will learn differently because each child has a different personality. So this conversation is very, to me, synonymous because I have two different children. One is a lot older, one is a male, one is a female, huge age gap. They have two different mentalities and they both learn completely differently. And to me, that means that you have to have a good preceptor, and that preceptor has to be able to have that understanding that not everybody learns the same way. Some people you can give that tough love to, and some people you can't. And I think a good preceptor will make that connection. That distinction, rather. Yes, absolutely. But for those of us that haven't had that preceptor or that mature and experienced nurse that
knows how to handle their emotions.
Exactly. And they do dish out that tough love or just downright meanness. How do you handle it?
I think they're sad. I think how do you handle it?
Well,
how do you handle it?
I can say how I handled it now. How I would handle it now versus how I handled it then would be completely different. How I handled it then, like I told you, like I wanted to become better and I knew that I was new, so I just took it. And I'm not saying take it. What I'm saying is don't take it to heart, because at the end of the day, I feel like you can't take it to heart. You can't, because you go ahead, please.
You can't have thin skin.
Yes.
And by what I mean by that, and I don't want to
this is true. This is so true.
Have it become like, okaying bullying effects. No. In a hospital, you have to understand it's a very high risk, high reward situation. Right. People's lives are on the stake here. I get all that. And I know that we need to prove ourselves to our preceptors and to our colleagues so they have their trust in us.
Right.
But there are two routes that we can take. One's a little bit nicer than the other.
Exactly. And what you're saying is you have to be able to take constructive criticism at the end of the day. You're new. You're going to be criticized. And
it's expected for you to be criticized. That's the only way you've learned. If I let you let me keep doing what I'm doing,
you won't get better. And then I'm not being a good preceptor, just like you wouldn't be a good parent if you're letting your child do something continuously in a wrong way when you know that there's a proper way to do things. And same thing, like, be able to take that feedback, because you're not perfect. You're never going to be a perfect nurse. I mean, you're never going to be a perfect human. So there's always something for you to learn. It is, keep that in your back of your head. But to answer your question, now I would definitely pull that person to the side and have a conversation with them and say, listen, I feel like I'm being bullied at this point. Now I would use those words, because
it's okay to use those words.
You can use those words. And I think people automatically understand what that feels like, because everyone's been bullied at some point in time in their life.
Seen it. Even if you haven't experienced it, you know what it looks like.
Exactly. And so, if that person is to me, a decent human being, they're going to take a step back and say, hey, maybe I am bullying this person. But unless you stick up, unless you have the confidence, and confidence is my theme for this year. Unless you have the confidence to actually stand up for yourself and say, hey, I feel like I'm being bullied, they're probably going to continuously do it. And believe me, they will respect you so much more if just say it. Just man up, woman up, pull up your big boy and big girl panties and drawers, whatever you got.
Or commando.
Or commando, some of you shouldn't. Some of you shouldn't. But yes, and just say, hey, speak up for yourself. And if that doesn't work, then go up the chain. Now you want to go to your charge nurse, then go to your manager, and go up the chain until you're getting the response and respect that you feel like you deserve. But how about you?
Same. Ditto. No. Dude, if I experienced this when I was a new nurse, I think I would have not stayed as a nurse. I think I would have turned around and said, if I'm walking into a field that my perception, my naive perception, my whatever, right? My perception was that I'm walking into a field that's based off of altruism and, a level of humanity and respect and understanding that we're walking into people's worst moments of their life. And these are the mentalities that are entering this work field, right?
Yeah.
So my expectation, I'm not going to even pretend, was that I'm walking into a very high professional level setting. Spoiler alert. It never gets better. High school is as best as it gets.
Oh, man.
Okay? It really doesn't. It really doesn't. Like, if you learn how to navigate corporate world or any job, that means now you can go back in high school and redo it well.
And it'll be just like...
Right? But it's the same thing. It's
popularity contest.
It's sad. But this is the difference with professionalism and the private sector. My work ethic, your energy of wanting to become better, right, will speak for itself for the people who are paying attention. For the people who are not paying attention, they don't matter. That's just noise.
Yeah.
And that's the mentality that I have. I would, at this point, let the person know if it's becoming too bothersome for me or too distracting. But now I find myself relying back on my experience and letting my work speak for itself. So what I've started to do actually now is, if I do make a mistake or if I do something that's alternative to what they would have done, right? Because that's where you, as a novice versus as an expert, can make that distinction. As a novice, you don't know what you did was right or wrong. So you will have some self-doubt. So if somebody questions an alternative way of doing it, you will question yourself that you did it wrong. It can impact you.
Right.
Once you realize that method can be done more than one way, and if I do choose to do it in an alternative way and somebody comes at me in an aggressive way, I can stand up by giving them the evidence behind the work that I do.
Right.
And that will shut them down. So 2 ways of approaching it. Let your work speak for itself and speak to it, right? Or outright confront them and let them know that, look, emotionally, you're causing distress unnecessarily. Tell them that, you want to learn from them, give them, there's an expression in Farsi, in Persian, that says that we're going to stick a couple of watermelons underneath each one of your armpits. And that's their version of, like, we're going to bloat your, blow hot air up your,
Okay.
we're gonna bloat you. We're gonna bloat you a little bit.
Right.
Do that.
Right.
Give them a compliment. Let
Right.
them feel good about themselves. Right. They're the more senior person. They're the more learned person. At least they have that perception. There's nothing wrong with allowing somebody to feel good about themselves,
Right.
especially if they can turn around and, one, make your life easier, and two, more importantly, teach you something. So long-winded answer, but
Yeah.
same thing. Ditto.
So here's the thing. Here's the thing of it all. I feel like healthcare is extremely, extremely stressful enough, right? Like, we got enough things to concern ourselves about while we're at work, while we're dealing with patients, while we're dealing with families, while we're dealing with each other. So my thing is, let's keep that in mind whenever we are precepting, whenever we're training somebody new, that it's already a high anxiety, high stress job. We don't need that added stress when you're trying to learn how to do the job. Now, granted, there are some lazy, not so good new nurses. Granted.
Lazy people need not apply.
There are. And I think that, when you identify those new nurses that are lazy and that aren't really, there to really do patient care like the way they should be, there's a way of handling that. Like go to your manager, go to somebody, particularly your manager.
First.
Go to them first. Exactly.
Go to them first. Give them an opportunity.
Perfect.
Right?
Great.
There's nothing worse than being blindsided.
Right.
Go to the person first. Give them an opportunity to learn. Give them an opportunity to change.
Right.
They might surprise you.
Right. Because they might not know. They might not know.
If you're the first person who spoke up to them,
mm-hmm.
They might not know.
You might not know. No.
What a great opportunity you're giving to somebody to better themselves. Right?
But granted, there's a way to do it. That's not bullying. And I think that's the part that needs to be highlighted out of this whole thing. Yes, you're going to be a new nurse. Yes, you're going to make mistakes. Don't go into this thinking that you're going to be perfect every day. It's impossible. It's impossible. There's going to be that one day when you're so super busy and you got a lot of things going on and you make that one mistake. So don't think that no nurses will, I don't care how experienced you are. The most experienced nurse will make a mistake. Doesn't matter. So get that out your head that you're going to be perfect every day. It's not going to happen. 2 is, like you said earlier, know your craft. Like, if you come in there and you know your stuff, like if you know your stuff, like if I come to you and you know your patients, like that's probably the best advice as a new nurse. Know your patients, know what medications they have, know their disease process, and know what you could be and should be concerned about. That's half your. Go ahead.
So here's a freebie. And I tell this to all my clinical students. When you're a student and you're a new nurse or a new practitioner or a new doctor or a new healthcare, your ability to communicate with another person sets the tone with everything. Mm-hmm. So your ability to give handoff is huge. So it goes back to the basics. Give a systematic handoff that's pertinent around the patient disease processes, and then historically go backwards to the least important or the least things that can kill you or the more chronic stuff that we're treating or not treating. Mm-hmm. Right? That's a freebie.
Yeah.
Because you're right. If I come at you with a patient history, mm-hmm. doesn't matter which shift, and I'm all over the place, mm-hmm. and I start talking to you about the person's, brother, sister-in-law's cat, dog, whatever story.
Yeah.
What does that have to do with what they're doing here?
It means you know your patient. You know your patient. And I'm sorry. Like, if you know your patient, nobody's going to mess with you. No, nobody will mess with you because you know your stuff. You came in to work prepared. You left work completed and prepared, and you did everything you were supposed to do. Nobody's going to mess with you. So at the end of the day, if you're doing all that, nobody can bully you. Like, nobody can bully you because
they can try.
Yeah, Yeah.
But they'll fail.
They'll fail because you know your stuff. Why didn't you give this medication? Oh, I didn't give this medication because
were X, Y, and Z, and the past 3 was this, and the map was that. So therefore, I didn't.
Yeah.
Would you have?
Yeah. And you say that confidently, nobody's going to mess with you.
Don't say that with an attitude. Like
No,
I just
no.
But you know.
But there's a difference. Confident and attitude is completely different. Like it's just like there's a difference between the militant version and the bully. Like so, but I want to dive into the militant and the bully version.
Sure.
So I felt like I had a militant, somebody who taught me, a preceptor, and I felt like I had a bully, and there was a complete difference, right? And the bully, I didn't learn from. I made me nervous. Really didn't help me to learn, but the militant did. Both, I always made sure all my I's were dotted and my T's were crossed, but
for 2 different reasons.
For 2 different reasons. One, I attribute all of my, not even all of my nursing success, but my foundational success to one person. The other person, I hate the guts. So which person do you want to be at the end of the day? And some people might not even care, but for my story, I want to be that person that helped them become the best nurse they can possibly be, versus the person that, if they were drowning, I'm gonna let you drown because I hate you just that much. And that's the real talk. Okay.
I'll still call BS on that because I know you. You still wouldn't let them drown. You still wouldn't let them drown. I know you would. It's because at the end of the day, if you let that person drown, another person's watching you, right?
No, it's true.
And another person's going to be like, all right, so this person's not the type of person that will help. It's a ripple effect.
Yeah.
Everything we do in a hospital is a very close community, and it's a ripple effect. Being able to speak up for yourself is important. Not everybody can do it. Finding your resources so they can speak up on your behalf is important, but not everybody does it.
Right.
Speaking about your patients and speaking to your craft is the first and foremost easiest thing that we can do.
Right.
Easiest thing that we can do. And even there, we'll still make mistakes.
Yeah.
Right. But at the very least, we did it with the intent of growth and safety.
Yeah. I'll never forget, one of my uncles told me this thing about women that I apply to all areas of life. Actually, he said, it's not about finding the most perfect woman. It's about finding the woman with the least amount of issues that you can tolerate. Right. And so to me, I approach
with any partner. That's any partnership. Business, private,
exactly,
personal, romantic,
right,
you name it.
Right.
You find somebody with the least amount of problems.
Yeah.
That's called your best friend. That's called your wife. That's called your husband. That's called your perfect boss, your perfect preceptor. Yeah.
But if you can come to work, and you can walk away and go home with the least amount of issues, that's a good day at work, man. That's a good day. If you could go home and it went smooth and you had just minimal issues, to me, that's a great day. That's a great shift.
We had a shift just recently, and I ended up being in charge. I had a student with me. I started off my day with a rapid response. So as a new practitioner, the person goes into SVT. I have a brand new student. I'm in charge of the assignments and the beeper of the, so the admissions come through me and stuff like that. But I had a good crew. And even though, I've probably annoyed some of them, and I know for a fact that I've asked, the same question multiple times probably, and I've annoyed them, and, circumstantial other stuff has happened or whatever. But with that said, these people were so professional that they realized that, I needed help, and they walked into the room with me. They made some suggestions that were, helpful and reminding and stuff like that. Ultimately, I ran my rapid response. I did everything that I needed to. I'm the one that, but the fact that they took that extra 5 minutes of their time and show that support.
Right. Monumental.
I walked away from that shift saying, this was a good shift.
Monumental. Yeah.
This was a good shift. It was a bad shift,
but
it was a good shift.
The people you were with. Well. Yeah. And that just goes back to what we said the last episode. Your team, your crew matters. And if you got a good team, if you guys are, first of all, if you guys decide at the beginning of the shift that you're going to be a good team, that alone.
Positive affirmation. It's a beautiful thing. I've seen units, and I saw it on your previous units, and I've seen it on my previous units, and I've seen it on places that I've worked. In the beginning, I've seen it consciously and I've seen it unconsciously. But if you make that conscious effort to say, we're going to have a good shift. Yeah. No matter what. Yeah. It sets that positivity, and people will say, naysayers and stuff like that. Yeah. They'll be there. But be like, no. We're going to have a good shift. I don't care what you say. We're going to have a good shift. No. I'm new here. We're going to have a good shift because we need to be that white cloud right now, and we need it. Believe it or not, it turns out to be a good shift. Yeah. Right? So imagine if all of you collectively decide at the beginning of the shift that it's going to be a good shift. I guarantee you 9 times out of 10, you're going to have a good shift. And if it's not... And you'll be conscious of it. Yes. And a good shift doesn't mean you're not going to be challenged. Like that's the thing. And that's what I used to think. I used to think there was going to be, a good day means nothing's going to happen. Or all my patients is going to be perfect. No. A good day can mean 2 codes. Yes. But you got out early. Because you had a good crew that helped you pass out medications while you were doing compressions. Mm-hmm. Yeah. So when you came back out of that chaos, you didn't have other chaos waiting for you. Right. Or you had the other nurses take care of your other patients because they were done medicating their patients and they knew you were taking care of your code. So now when you're done with your code, now you don't have a whole slew of people to medicate. Oh, yeah, it's been there. so these are like... You had a flashback, didn't you? Like, man, there are certain shits I wouldn't have gotten through if it wasn't for my people, my rest of my teammates. And I don't even call them like my colleagues. I call them my teammates because night shift was team to me, in my opinion. But yeah, man, and there was no bullying because we had to work together. But there's joking. Yeah, you had to work together. You have to have a thick skin. We will tease each other. That's expected. Right. I think it's human nature to tease each other. I think if you have a couple of siblings, you'll know that teasing exists. Right. It's humanism, I guess. I don't know. That's unfortunately hasn't been, it's still part of our nature. We tease. Yeah. And that's fine. As long as it has good humor behind it, as long as multiple people. And if you have an issue with it, please speak up. Give the person an opportunity to make that alteration before you jump the gun and either, castrate them and ostracize them and, alienate them or, throw them out the clique or whatever. Like, let them show themselves to you, right? Unless you're that evil, prejudiced, jaded, eat your own young monstrosity of a, healthcare worker. And you're a lost cause, and I wish you a long and happy health, end of a career. And lastly, you mentioned cliques, and I want to address that before we go, because I think cliques are just a natural part of being social creatures, right? Cliques are going to happen. I get along better with some people than I do with others. That's exactly a normal thing. But at work, I think it could be dangerous to be too cliquey at work, and I think that even if you get along with certain people more than others, if you find out that you're giving them beneficial treatment over the other, that's not right. That's not right, because there are going to be times when your clique is all off and you're by yourself, and then you're with somebody else's clique, and then you're going to wish that they treated you the way that they treated their cliquish people, and then it's just, it shouldn't be like that. So be cognizant and mindful of the clickiness at work. I mean, and it shouldn't exist, but it does. But it does. So let's face it. Yeah. Let's call it for what it is. Yeah. But we can move past it because we're adults. Right. And that's the thing. Because you don't want to be caught on
the short end of the stick, and you will be one day. I promise you. I promise you, it's
No
going to
matter how
happen.
popular or liked or unliked or whatever, you will find yourself on the other side at one point or another.
Yeah, you will. It's going to be that one shift, and you're going to be like, oh, dang, this is what it feels like.
And I hope you never feel it, but they do exist.
Yep.
They do.
Yeah. Yep. So yeah, lastly, nurse bullying is extremely prevalent. I mean, I don't think it's ever going to go anywhere. Nurses will always eat their young. Well, I can't say always. Let's be positive. You're right. Let's be positive.
No.
Let's stop it now.
We're not gonna eat our young
anymore.
We're
done.
Right. And if anybody does eat their young,
call them out.
You have my permission to call them out, because God knows I call them out now, right? It's one thing to, be on the receiving side of it. I have a visceral, the older that I've gotten, I've turned into this visceral allergic reaction to bullying of any kind.
Right.
And if I see it, I have to say something.
Yeah.
Even if it's in a jokingly manner to that person. Like, I think you were a little hard on him, or you were a little hard on her. I think she's just learning, or he's just learning, or whatever. You know what I mean? Like, I'll make it known that behavior was not super kosher. Right. And if it was outright, evil and bad, like, I would put a stop to it. Like, I would not.
Right.
But it takes a conscious effort to do that. And it might not be the most popular thing that you do as well. But at the end of the day, your conscience will be clear and clean.
Yeah. Call it out. I think that deserves to be said again. Call it out and be able to take constructive criticism, take positive feedback. And before you just automatically initially jump to, I'm being bullied. If you're in that situation, you do feel like in retrospect, take some deep thought, take some time alone and reflect on the situation and ask yourself, am I being bullied, or was this constructive criticism? And if afterwards that you feel like it was being bullied, then pull that person to the side, like you said, address the situation. And if that doesn't work, escalate as accordingly. But yeah, this has been another great episode.
Talk about.
Yeah.
Glad we talked about this one.
Difficult conversations in nursing. We should have more of these, and we will have more of these. Better Nurse Corp. All right, this has been another great episode of Better Nurse Corp. It's your favorite color in the world, brown, along with my co-host Ruse. And till next time, peace.